Well, adult congenital heart surgery is complicated because basically it carries a patient from birth, or before birth actually, prenatally, through childhood into adulthood. And it's a relatively new discipline because congenital heart surgery really came into the fore basically in the 80s, 70s, 80s. People were doing heart surgery. Before that, the outcomes weren't very good, so a lot of the patients didn't make it into adulthood. In the 80s, 90s, outcomes dramatically improved, so more and more of the patients survived to adulthood, and as a result, recent estimates are that there are more adults living with congenital heart disease than there are children, because there's so many survivors who have made it to that stage. Regarding why patients with congenital heart disease should go to a specialized center, there have been several studies, some very big studies, comparing the outcomes for patients with congenital heart disease who will go to, for example, a congenital heart surgeon in a pediatric hospital, or a congenital heart surgeon in an adult hospital, or a non-congenital surgeon in an adult hospital. The complex patients clearly do much better if they're dealt with by a team of people who do that all the time, because that level of expertise comes with experience, and you only get that experience with this sort of rare disease if you see a lot of those patients, and this sort of program centralizes that experience in a few hands, and therefore the outcomes are dramatically better.